welcome. Joining us on Fyzical, we are joined by Ting O as always, and today we're going to be talking about low back pain and sciatica. So why don't we start off, could you give us a review coming into this episode, what we're going to be talking about today, and things to know about lower back pain?
Okay, yeah, so firstly a little bit about low back pain that a lot of people may not know. So low back pain affects a lot of people. So research has shown it's going to affect about 80% of people sometime through their life. And that's pretty much everyone, myself included. So treatment of low back pain is something that we would like to discuss today, because what people don't know is that in the medical community, when we see people with low back pain, historically, we've been tasked to classify people into 3 different diagnoses or segments. One of them is non-specific low back pain, which is where approximately 80% of people suffering with low back pain gets classified into. So if you think about it, when you're talking of a condition called non-specific low back pain, trying to treat something like that is not very easy because it's non-specific, so there's no direct protocols for that. So one thing I'd like to educate people on today is ways that you can try and classify yourself better in sense of what low back pain is. Different classification systems that we have includes if it's a discal problem, if it's a stiffness problem, if it's a muscular problem, if it's an SI joint problem, and also if it's a muscular, I think I already said that, instability problem. So there's several tests that we can do that can help classify that. And once we know that, we can obviously direct treatment more specifically to that particular problem. So for example, we would treat something with a muscular problem a lot differently to someone with a nerve problem. And we'll show some of that with some demonstrations later. And finally, obviously there's been a lot of research that shows that exercise helps with low back pain. So I'd like to show people, what types of exercises, how often, all that stuff, what not to do, and what you can do once you get over your low back pain to continue on the right track to try and prevent it from happening again, which we see a lot of people, once they suffer from low back pain, tends to have it recur every year, every couple of years, and there's a lot of things, though, that you can do to try and prevent that. So we'd like to give everyone a good rundown of low back pain, how to figure out where it's coming from, how to get it treated, and what you can do to prevent it from happening again.
All right. Join back with us as we get into that subject on how where it can come from and how it's treated when we come back to Fyzical. Thank you. And welcome back. And we're going to start off talking about back pain this week. We are talking about, it comes from the back, obviously. So some of the areas that you can specifically feel back pain in, where it's commonly found.
Right. Yep. So, yeah, low back pain, obviously low back, but there's a condition that a lot of people get called sciatica. And sciatica obviously runs down you'll feel pain in the back, but pain will either shoot, tingling, numbness, burning, all sorts of sensations down the leg. Classical sciatica goes down the back of the leg, but people with sciatic type symptoms can also get pain in through the hip, the groin, the front of the leg into the knee. So low back pain, even though we call it low back pain, can encompass a lot of things down into the legs as well. So one thing that people should be aware of is that low back pain may not necessarily come from the low back, which is a weird thing for people to grasp. But there was another research that was done recently that showed people with low back and hip pain at the same time, which happens with a lot of people with low back pain and sciatica, so maybe in the back and the back or side of the hip. What they did was they took those people, they fixed their hip, and in around about 50% of the cases, the low back pain went away. So the theory in that respect then is potentially the hip is the cause of a lot of low back pain. So understanding where the low back pain is coming from is number one when you're trying to figure out what to do about it. So in our clinic here, what we've done is we've incorporated some diagnostic testing, and which allows us to be able to more specifically determine whereabouts the pain is coming from, to obviously help our treatment processes. So the classifications that we've divided people into, instead of non-specific low back pain, we've broken it down into like 4 or 5 different segments. So one is what we call a discal type pain. And that type of pain is where someone has is an acute pain, something that's happened recently. They have a lot of difficulties bending down. They're kind of like stuck in the half-bent position. And in those respects, you would treat it like a particular way. So to determine that, what we would do is to, through a physical exam and through what they present to us, we would be able to determine whether that is the case. The second one that we classify people into is just generalized stiffness. This is where just if you sprained your back, you have some like muscle spasms in the back and through the hips. And in those cases, obviously, we do a lot of soft tissue techniques to try and sort of help with those types of people. The third case that we look into is what we call stenosis, or otherwise people might know as a pinched nerve, and sciatica as such. So in those cases, the back pain is not just in the back, but down through the leg and through the hip, potentially through the calf and into the foot. So those cases are very important to try and figure out what's going on, because there are cases that we've seen where we've thought it's come from the low back, but it's actually a pinched nerve down the leg. So one particular case I came across was a lady who had pain down the side of the leg here with some weakness in the foot. And she actually came to me, she was a previous patient, to ask me, she basically said, you know, my doctor wants to give me an injection in your back, what do you think? And I was like, okay, why don't we do one of the diagnostic tests that we do here called an EMG nerve conduction study. What that test tells us is it allows us to see if the problem is coming from a nerve in the leg or if it's coming from a nerve in the back. So once we did that test, we actually determined that she had a pinched nerve not in the back, but in the side of the leg, on the outside of the leg. So obviously having an injection in the back would not be helpful. So once we determined that, we were able to address the pinched nerve in the side of the leg, and it saved her some potential medical procedures that might not have done her any good. So determining that is very important. The third case we've come across is what we call sacroiliac pain. And everyone knows about sacroiliac, that little spot right in the back. So that sacroiliac pain usually is because of your hips being twisted. And obviously, if we figure that out, we would treat that a particular way. And the last process that we look at is what we call instability. And these are the types of people who like sit for a long period of time, get stiff, find it difficult to move, or they stand still. Once they stand still, or if they're moving, they're okay, but once they stand still, pain starts to build up over time. And when you have an instability problem, obviously, you know, we look at towards exercises trying to stabilize things. So the key thing we want to determine here with people with low back pain is, one, exactly where the pain is coming from. And fortunately for us, we're able to do some diagnostic testing here. Like I mentioned previously, the EMG nerve conduction study. That particular study is done to help us determine if the pain that you're feeling in the leg in terms of sciatica is coming, one, from your back, or if it's coming from a particular nerve down the leg, or if it's not coming from any of those nerves, it could potentially be coming from a trigger point, which could be like a tightness in a muscle in the back. And the other test we do is called ultrasound imaging, and it's kind of like allows us, for someone that would be looking at a baby when they're pregnant, ultrasound imaging allows us to have a look at people's tendons and soft tissue. And when I had mentioned previously that around 50% of people whose back pain and hip pain may be there together, and around about 50%, those people have their problem in the hip. So in a lot of cases, what we do is people that have hip and low back pain, we'll do an ultrasound image of the hip. And some of the things we pick up fairly routinely are things like tendinitis in the hip, potentially some partially torn tendons, and potentially some bursitis. And the same is true for people with back and knee pain. This way we can see if there's a localized problem in a particular joint, such as the knee or the hip, or if the problem that you're feeling is that sciatica coming from the back down the leg. So when we incorporate these medical testing into our repertoire, we can really, from the beginning, figure out what the root cause of the problem is. And once we do that, it helps so much in terms of treatment and directing care to the right areas. And if it is something that's obviously severe to the point where it's not manageable, we would obviously tell someone that as well.
And that brings us to a great transition there. In treatment, what are some, once it's determined where it's coming from, where do you, and you focus on treating that area, what are some of the things, the common causes that you find through treatment? What are some of the things that you utilize to do a treatment?
Yeah, so once we determine, so the key thing in treatment is to, one, hone in on the type of problem it is. So for example, example of the hip pain, if we find out that one, the problem is in the hip and not the back, we would, one, target our treatment to the hip, because if we work on the back, that's obviously not going to help the problem. So in terms of our ultrasound diagnostics, if we find that it's, if the tendons are not problematic, there might be just some tendinitis. Tendinitis happens, and when it's tendinitis, what we do is we have to try and remodel and break down some of that tissue to allow it to reform again. And exercises will help that in terms of like getting that tissue strengthened. We have a great machine here called the Miracle Wave. It's an acoustic wave machine, and what it is it kind of it's a machine that allows us to get deep into the tendons to break down the tissue to allow that tissue to reheal and reform. But if we find on ultrasound that someone has a partial tear, we obviously have to be a little bit more conservative at that point, because if you have a partial tear and you do things that are too aggressive for it, it could make that tear worse. So one thing we always say is that when you have a partial tear, looking at the healing time of tissue, you got to give that tissue between 2 to 4 weeks to heal before you really try and stress that tissue. So if you have a partial tear and you're trying to exercise really hard and work on strength, obviously that's not going to work. So understanding the actual integrity of the tissue is important, which is why we take a lot of into account the ultrasound imaging, so that we can see if the tendon is, what type of shape the tendon is in, and it allows us to shape our treatments towards that. If we find that it's a nerve issue, so for example, if we do an EMG and we find the nerve is just bruised, obviously we can get into the tissues around that nerve, try and stretch the nerve, trying to get the nutrition into the nerve to allow that nerve to re-heal. However, if we find that nerve is pinched, but the nerve itself is suffering some damage, it would be the same type of thought process as if there was a tendon tear. So if you think of a nerve that's damaged, you're not going to want to stretch that nerve too far. So more aggressive techniques for that nerve might actually make that nerve worse. So the good thing about the imaging is it allows us to see the severity of the injury, and based off that severity, we can treat either aggressively or conservatively, and knowing the healing time of tissue, allow that tissue to remodel and form itself to basically heal.
All right, we'll come back and be discussing a little bit more about treatment, and then get into some exercises and anything with that. And welcome back. So we were talking about treatment before. Could you continue a little bit on just some more treatment methods that you guys utilize?
Sure. Yep. So when you get more specific into back pain versus just non-specific low back pain, so for one, if it's a discal issue, usually that's an acute issue where the disc is starting to bulge a little bit. And in most acute cases, treatment based off like trying to not exactly relocate, but put pressure or stress to try and reform that disc bulge can be helpful. So in most cases, some very gentle soothing techniques we would use to try and reduce muscle spasms, to reduce swelling, to just make someone comfortable. And then there's a series of exercises called Mckenzie Exercises. A lot of physical therapies would know those. And people that have been to physical therapists for low back pain would know that as well. So when it's a discal issue that's acute, something that's happened recently, and you're kind of like stuck in this position, you can't move, Mckenzie Exercises are kind of like the go-to for that. If it's a stiffness problem, like I'm assuming for you, Phil. So in those respects, obviously you got to get into those stiffnesses to try and loosen them up. So for the lack of a better term, we use what we call a lot of manual therapies or hands-on therapies for that. So what we like to do is we like to get into the soft tissues, break up the tissues, look for the knots, release the knots. And we have a lot of techniques that we utilize, like medical cupping, like scraping, or what's called instrument-assisted soft tissue mobilization. We use a whole host of techniques to try and sort of loosen tissue, muscles. Plus we like stretch and all that stuff as well that you classically do. If it's a SI joint problem, what we have to do is try and rebalance the SI joints. I don't know how much people know about the SI joint, but a lot of people will say that my hip's out. In a sense, that's kind of like what happens when your SI joint is not sitting in the right position. So there's a lot of techniques we can do to help you correct that hip being out to such, balance the leg lengths and all that stuff. And finally, if there's an instability in that respect, an instability just basically means that your spine may not be as stable. Some people are hyperflexible, and when they're hyperflexible, they just need more muscle tone to be able to control that spine. So when you're have an instability issue, we work a lot with people. Obviously, one, to try and minimize the spasms, the tightnesses, and then we work on concentrating on focusing on strengthening and stabilizing the core, which is designed to help with rotary stability and also with forwards and backwards stability. So we really work on, we have a whole host of techniques to try and loosen spasms, look after knots, help people with like pains. So our core belief is, one, when someone is in pain, exercise is great for low back pain, right? Well, there's no sort of arguments about that. But when you have pain up to 8 out of 10 and I tell you to exercise, you're going to look at me weird, right? So our role is, one, to figure out what the problem is. Two, we want to reduce your low back pain to a level below about a 5. Once we can do that, then we can help you to start stabilizing, strengthening, stretching, and all that stuff, which is in the long term is what's going to help most people with low back pain.
How do you guys advise for people to go about these exercises?
Yeah, so there's different types of people. There's some people that come in and just say, show me your exercises, and I'm good with stuff. So those types of people, yeah, we love to show people what to do so that they can keep themselves healthy. So if you're the self-starter type person and you want an exercise program, we'll help you with that as well. But most people we find need some supervision because most people don't know their body too well and not sure what to do and how to listen to your body as well. So most people when they come in, we design an exercise program based off the condition we place them in. So for example, with the Mckenzie exercises, there are 2 to 3 or 4 types of different exercises, protocols that you may do depending on how you react to each exercise program. So without having experience in that, I would suggest you have someone like a physical therapist, us here, to guide you through step by step. We have a full gym that's open to the public where you can come in and basically use us as a gym, but still have someone there you can talk to and communicate with in terms of, hey, you know, Ting or Mike, who's our gym manager, you know, I did this today, my back kind of hurts, what do you suggest? Should I be doing this or should I try something different? So in terms of exercises, exercising is very important, but understanding the types of exercises, what to do and what not to do, because if you have a discal problem and you're doing a lot of things like loading, doing squats, that might not be the best for you. Or if you have a stiffness problem, and a lot of people think more pain, no pain, no gain? Not true. So if you're more specific, targeting exercises to your specific problem, that is a lot more effective. And once you get into the maintenance phase of maintaining yourself and working at preventing pain from happening again, there's all sorts of programs we have here that are available to people. We can help them develop a program. We also have personal training here, group training classes, and also buddy training classes that people can get into to keep themselves in shape. And also, obviously, when you work with a trainer of any sort, they would want to make sure that you don't do anything to really, I should say, reduce the risk of injury, because obviously we want to keep people as comfortable and as healthy as possible.
Perfect. All right. We'll get back for a summary and just talking about some of the things available here at Fyzical that you can find. So, we are back. Why don't we talk about some of the things that Fyzical has to offer in terms of for lower back pain, sciatica, anything like that, as well as just in general.
Okay, so obviously at Fyzical here, we're a physical therapy clinic, and one of our specialties here is treating people with low back pain and sciatica. So for the people out there with low back pain and sciatica, if you're not happy with the way things are developing at this stage, there's some alternatives that you can potentially try to help fix your problem. So one of the first things to do to start is figure out exactly what's causing your problem, and that's one of the things we like to do here. So through some testing, medical testing of sorts, we like to do the EMG and ultrasound. It allows us to pinpoint exactly where your problem potentially could be coming from and what that problem is, whether it's a pinched nerve, whether it's tendinitis, whether it's like a torn tendon, or whether it's something going down your leg further, like a pinched nerve at the knee or the foot. Once you figure that out, it allows us to target your problem a lot better in terms of trying to fix that back pain. So for example, like I said previously, if you're having a hip issue that's muscular, treating a nerve in the back is not going to help fix that muscular tissue in the hip. And if we find that you have a torn tendon in the hip, obviously at that point, if we shouldn't have you exercise for several weeks, because if we have you exercise, it'll actually make that tear worse. So understanding your problem is number one, and then targeting treatment towards that problem is number two. Number three is making sure that you continue on the course, because physical therapy, a lot of times I say, is just the starting point. Once you get done with physical therapy, our goal is to help you continue to feel good. And obviously that's done through things like exercise, which is what potentially helps most people with low back pain. So for the people out there with low back pain that want to know more, we always offer to the people here watching WYLN a free question and answer session. It's a free 20-minute session where you come in, talk to one of our therapists here, tell them your problems, and potentially see if there's anything we can do to help you. So all you have to do to take advantage of that is give us a call here at 570-501-1808, and just talk to them about watching the show on WYLN, and you would like to come in for a free 20-minute question and answer session. We have great therapists here that can help you determine what's causing your problem.
Well, thank you for talking with us. It's always a pleasure.
It's always a pleasure here too.
And thank you all for joining us here on Fyzical on WYLN.